You know, we are used to seeing, Ken, photos of celebrities sporting sky-high heels. I literally will look at these women and I'm like, how can you possibly wear this?
How do they walk?
They look uncomfortable, but are they really bad for your health? In today's edition of Doc Hollywood, I talked to Dr. Audra Mintz. She's a foot and ankle surgeon at HealthPartners Clinics. I asked her all about high heels, bunions, and a little something called plastic surgery for your toes. Hey everybody, Happy New Year. I'm here with Dr. Audra Mintz. Hi Audra, nice to see you.
Hi.
So you are a foot and ankle surgeon. We've got lots of foot questions to get to. First of all, a lot of people losing weight this time of year. They have their resolutions. Megan Fox, Pamela Anderson, and Kelly Osbourne. They've been offering up some tips for the new year on how to lose weight. But I think we should take it down to the feet. How does extra weight impact your feet?
So extra pounds certainly can put extra stress on your foot and ankle. This can lead to problems short-term and also long-term.
So this can be kind of a struggle because you think, okay, you want to lose weight, but your feet hurt, so it can be maybe tough to exercise. So then how do you lose the weight? Is that tough for some people?
Right, I hear that all the time this time of year in the office. Doc, I'm trying to work out, but every time I work out, my feet are hurting.
Yeah.
What I suggest for these patients is be sure you're in a good shoe with a good insert and start with something a little bit more low impact, like an elliptical machine or swimming or a stationary bike versus a treadmill.
Big trend to talk about, and Dr. Mintz, I have a feeling you're not going to like this one. This is the increasing height of heels. Jessica Simpson and Snooki, they didn't even want to take off their super high heels when they were pregnant, and Victoria Beckham is routinely spotted wearing 6-inch heels. Okay, how does this impact your feet?
It doesn't really take a doctor to tell you, probably not the best idea. When you wear shoes like that, you pay for it the next day. They throw off your posture, putting extra pressure on your knees, hips, and back, and also it puts a lot of pressure on your forefoot, which can cause anything from stress fractures to nerve impingements. I would be lying if I said that I did not have a pair of high heels
The truth comes out.
or 5 in my closet at home, but you just need to be practical. Have a couple pairs that you can wear all night long, have some that you just save for a special occasion, but always have a pair of flats with you just in case.
Good idea. So a pretty common problem, I know you have to get asked about this a lot, the bunions. Jennifer Aniston reportedly had them. Victoria Beckham has blamed her high heels for getting her bunions. We got to talk about what are they, what can you do about them?
Bunions are bony prominences that you see on the outside of your foot, and they're often caused by genetics. So you're born with a predisposition to develop bunions long term.
I would like to take this moment to thank my grandmother for that. Okay, keep going.
Yeah, so basically you get this instability in your midfoot, which causes your bones to grow farther and farther apart from each other over time, making them a little bit more prominent on the outside of your foot. Everybody can develop bunions, men, women, people who wear shoes and people who don't wear shoes. The reason why our bunions become painful is because we have to wear shoes, and especially as women, we have to wear narrow and tight shoes. And shoe pain is initially the first time that people start to get problems with their bunion. The only way to get rid of bunions permanently is with surgery because it is a bony abnormality. But the main thing I can suggest is just try to wear shoes with a wider toe box. Sometimes you can go and actually get the shoe stretched specifically in that area to accommodate the bunion and go from there.
Well, Dr. Mintz, thank you so much for your time. We so appreciate it, and here's to no bunions in the new year, huh? So I also asked Dr. Mintz about this trend of plastic surgery for your feet. Like some people are getting their pinky toe removed so their feet fit better into tiny toe box shoes. And she says, don't do it, peeps. Only get foot surgery
So my
if you
reaction
really
was
need
good.
it. Yes, yes. She says it's a bad idea, in her opinion. Only get surgery if you really need it for a medical reason on your feet, not for a cosmetic reason, because your feet are complicated little tootsies.
I think I'd just buy bigger shoes.
Yeah. Good, wise.
Instead of chopping off my pinky toe.
I don't, what do you have against the pinky? The pinky's a great deal. Okay, head to TwinCitiesLive.com to vote for next week's Doc Hollywood topic. Just click on Only on TCL. We want to thank HealthPartners Clinics and Regents Hospital for sponsoring the show, and always check with your physician if you have any kind of health concern. We got more TCL coming up.
I'm checking my pinky toe.
It's okay.